that's the whole thing, right? If you have a very secure and stable infrastructure for using medical data in an ethically sound manner, this isn't too difficult. Of course, there are difficulties in getting the calls from the actual registries and getting the permits. But if you do it right, there's no real ethical issues with it, because the data is anonymized so that only the machine actually hears it, and it's not shared with anyone, so no one gets the information on the individual. But in a larger sense, if you look beyond our own borders in Denmark, then we have the problem of actually getting these data in a manner where we're certain that people aren't identifiable in it, and that their data is obtained legally correctly. And the thing about a system like this is it has to be adapted to the specific place you're at. So we made ours for the capital region of Denmark, and we're actually planning a randomized controlled trial in the region of Zealand in Denmark, which is fairly close. But still, we would like to retrain on this group specifically to make sure that you're not training on one group and then it doesn't perform well on the other group. And that will be the challenge as well. So while this shows that this is possible, and we're very pleased with these results, it needs to be remembered that you need to adapt it to where you are. So if you want to go down this road and use machine learning technology, which can help us get more patients the help they need, you need to commit the resources and the time to get the data in an ethically sound manner, and to get it and to commit over time to actually implementing this, because it will only improve if it's used in a real clinical setting. So while the first results are very promising, it will improve even more later when it's actually used and we can work more on it. I wanted to mention that we were planning the new clinical trial. We're hoping to do that in 24 or 25, probably more realistically. But we're very optimistic about actually using this. One thing I think is important to mention is that this isn't meant to be taking a stab at the people who are actually trying to get the patients the help they need, the call handlers. They're doing a very difficult job, as I mentioned previously. It's very hard to get these patients the help they need when the symptoms are so diverse and patients don't often know exactly when things started. So what we're hoping with this is a tool that can help them in this task. So it can be seen as a supportive tool, something that they can use, something that makes a difference. And that means that you also have to use their expertise when designing how you want to implement this as well. So we're really hoping to help out the call handlers with a difficult task in this.